A very good evening to you, our dear viewer. We are grateful that you are watching Church of Uganda Family TV at this time. This is HealthPot. HealthPot is a program brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. And here we talk about maternal and child health. We also talk about early childhood development. We also talk about other public health concerns. Edwin Austin Mukalazi is my name, your host. And today we are really talking about a gender-sensitive topic because we've had very many issues where mothers are left to do most of this work, especially when it comes to feeding the child in, all that, what we call infant and young child feeding. Now, you as a husband, where are you? What is your role in all this? So, we are with the one, Pamela Kihembo, who is a public health nutritionist from Makerere University School of Public Health. Pamela, I'm already excited to discuss this topic. Now, kindly greet our viewers and then we get into the discussion.
Okay, good evening, our viewers. Pleased to be here again. This is the fifth time since the last month, the breastfeeding month of August. So we have had so far 4 sessions about breastfeeding, and then we talked about complementary feeding, but we're talking about mothers, breastfeeding, preparing complementary foods. But today I would like to explore into how men can support the mothers to breastfeed and also to complementary feed and also generally raise children.
Okay.
Yes. So
that is very, very interesting because oftentimes we ask ourselves, what is our role? Our role, we think, as men, our role is to wake up, go look for the money, bring food on the table. But let us discuss male involvement as a phrase.
Okay. Yeah. So basically, male involvement is males or fathers and other members of the community to actively, mark the word, actively participate in the feeding of children. That is male involvement. So you bring in the money and you think, okay, it's one of the ways in which you can involve yourself, but it is not the only way in which you can support these children to feed well. So male involvement is you doing the extra and become more physically, socially, and emotionally available when we are talking about infant and young child feeding.
Okay.
Yes, and it has been a neglected topic.
True.
Yes, it has been neglected. The work for women, infant and young child feeding and raising of children has entirely been left to women. When you are well behaved, your father's daughter or your father's son, when you're badly behaved, they call you mother.
And the Luganda saying is, I wonder when the father comes in.
Exactly. Yeah, so we have been neglected roles. We have gendered, what they call gendering roles. Gender roles. Women are supposed to be at home raising children, cooking, washing, all that kind of stuff.
I partially think it is culture. Some cultures have groomed women to be home taking care of the children while men are out working to bring food on the table.
Yes.
And perhaps because the cultural ego is so strong in certain men, that is why they end up underlooking some of these roles that we are just bringing in as support.
Actually, Edda, musajja bwe yajjanga ewaka abaana bayingira mu bisenge.
Exactly. And
then you grew up hating your father because he was never there. You feel these things when you are old. Like the father is very distant, which is very dangerous because they never bond with their children, and they never bond even when they grow old, and it's not good. I've heard stories of people saying, my dad no. Yeah, yet he's working so hard, he's paying tuition, your mother is not doing much, but because of the emotional support that they provided, find children are attached to their mothers compared to their fathers.
Okay.
Yeah.
So what are some of the benefits, or what are the benefits of men or male involvement in infant and young child feeding?
Yeah, so research has shown that children who have had so much interactions with their fathers when they were young and during feeding times, one, they are likely to be more confident. That's one. Two, they are likely to be more intelligent compared to children who did not interact with their fathers. They are likely to be more developmental, yeah, and that cognitive psychosocial development is more pronounced in children who have been interacting with their fathers quite often compared to children who have not.
Okay.
Yes, and also the bonding.
Mm.
Yes, you need that bonding. The mother, I mean the child, needs to bond with the father. Remember, when you are breastfeeding, when you are a lady and you're breastfeeding, that is the time when you bond with the child. But when does the father bond with the child? So bonding with the child is the only opportunity that the father has to bond with the child is them being actively involved. Yes, and we are going to see different ways in which fathers can be actively involved in infant and young child feeding and upbringing.
Okay.
Yes.
But before we get to the to the different ways,
Yes.
when you talked about bonding, I personally thought it was natural that a girl child will bond so much with the father, and a boy child will bond so much with
Not
the mother.
really.
Where does that magic come from to cause that bonding, to see that a father can now sit and the son and they talk and they have that mutual understanding?
Could you please repeat
No,
your
I'm
question?
saying I'm
Yes.
saying that like the naturality of the male involvement that
Okay.
causes the bonding between the father and their children, irrespective
Okay.
of their sex.
Oh, so you're talking about the different ways in which the males can involve themselves.
Probably.
So one of the ways, the most natural ways, of course, to provide. So when you provide and things are there at home, that's one way, and that's what men think they are supposed to do. But the extra ways in which they can support is one, holding, babysitting their children.
Mm-hmm.
Let me tell you, if you're working father, before you go to work, you can want to first see the children before they go to school, or before you go to work, ask, greet them in the morning, ask them about their night. Then you can go to work, or you can even have breakfast with them. And when you're having breakfast there, you are teaching them the good feeding habits. You understand? Yes, so you are telling them this is not good for your health, this is good for your health. Drink your juice, eat your vegetables. Not necessarily the woman emphasizing the good eating habits. Don't leave it only to the women. Also you participate when we are eating breakfast before you go to work. Be there. Encourage children to drink water. Encourage children to drink juice. Eat their vegetables. If they have completed a task of eating maybe a particular food that they do not like, give them a gift. Yeah? Give them a hug. We call it a positive reinforcement. Yeah. Give them something. Let them be. Know that you care. You care about what they eat. So that is one way in which you. That is
So they
the
also
other way.
see that you are available, you are around.
Yes, you are around, you are encouraging them to eat healthy on top of buying the food, by the way. Yeah, yes. So you buy the food, but also make sure that the
You eat
children
with
you
them.
eat with your children. We remember we talked about active feeding
Yes.
last week.
Yes.
So eat with the children, encourage them to eat their healthy foods. If you're going shopping, most of the time it's the ladies who do the grocery
True.
shopping, but also men. I've seen homes where men do the shopping, especially for stay-home moms. If the fathers are going for shopping, go with the children. Take them in the car. Let them go to the supermarket. Let them go to Kadere. Let them shop their food. And you, when they are shopping, don't encourage them to shop junk food. Encourage them to shop healthy food. Let them go shopping with you. Yeah.
So they can be introduced to some of these things.
Yes.
Well, let's take a short commercial break, and when we return, we are going to continue with the various ways through which a man can offer support, especially when it comes to infant and young child feeding. Please stick with us. Welcome back from that commercial break. This is HEALTHPOT. HEALTHPOT is a program brought to you by Makerere University School of Public Health, and here we discuss early childhood development, we discuss maternal and child health, but also not forgetting other public health concerns in society. Today we are discussing the men, the husbands. Where are you in child upbringing, especially when that baby cries in the night and you're supposed to support the mother to feed them and you only wake them up. Omwana wakaba. Well, that is what we are discussing today. Pamela, like I said, some of these things are really looked at as feminine. So when a child cries, even when you know where their feeding a cup is, and you know what to do when the mother is taking a rest, at least the instinct in you, the male instinct in you will tell you, wake her up to, to feed
yeah.
yes. Well, we are discussing the different ways. Which other ways besides being present, being part of their life, shop with them, eat with them?
So you had talked about a very sensitive topic.
Yeah.
You said when the children are young, especially the first 3 months. The first 3 months are usually hell for the mothers. There is what we call colic. Yeah. When the child is crying, when they have gas in their stomach and they feel pain. In Uganda they call it oboka. Yes. So during that period, some men can tend to be disgusting. I've had stories where women say that when the child cries, the father said, kalo mwana umudiro mubeleyo. He doesn't want to know anything. The mothers know. When the baby cries, they go in the sitting room. But do you know how stressful that period is? Mothers can do anything. You feel like you want to throw away the child. You get the point. So that is the time when women, or when us, we need men more. If today I've woken up, tomorrow wake up also. Or if I've woken up maybe from midnight up to 2, and the baby cries again at 5, also it is just about being human, knowing that no nayakowa, nayakowa. It's not about ego, it's not about being the man, I'm the husband. No, it's about being human and knowing that even this person also gets tired, so they need support. So I talked about the babysitting. So the men, if the woman is in the kitchen cooking, you hold the baby. If she has washed, she has to cook, she has to mop the house, you can also iron. Do you die? No, you don't die. You might not wash, but you can iron the clothes. You might not cook, but you can help me feed the baby. You don't lose anything. Remember, when you're feeding, you're bonding with your child. If maybe if we are a working family and I've come late from work and they've come early at home, help the children do their homework. You don't have to wait for the woman to come and help the children do the homework. You get the point. So those are the different ways you also being actively involved in the children's lives. If I've bathed, men can bathe their children, men can raise their children. That is now the upbringing.
Yes.
But the feeding, if the woman is cooking, then you can also feed. You know, if she's doing chores, you can also take the children out, take them to the neighborhood, show them important things, play with the children, the psychosocial development. I don't think that before, when one was still in the village, when we was still young, there's a certain man who used to be so actively involved with the children at home. People used to say that ntomukyala yamuloga yekaba kuloge naye ng'abaana bo they are close to you, and they have to trust you. You know, when the child trusts you, they can easily tell you anything that is troubling them. But if children don't trust you, you'll be like an alien to them.
Yeah.
Yes. Yeah. So that baleke leka bakuloge, but be, you know,
At
it
least
is
you know
for
the
your
benefit.
own benefit, for the psychosocial development of your children.
Okay.
Yeah.
Are there any other different ways in which male can offer
Yes,
support?
of course. When you're taking the children for immunization, yes, you have to go with your husband. It is encouraged during antenatal. You know, there are even reinforcements which they give to the males when you're going for antenatal. So when you go with your husband for antenatal, for example, in government hospitals, they give you priority. They see you first. You know, so the government should also come out and come with, you know, these ways in which we can force the men to be involved in the so-called women responsibility. So you can go with her to antenatal. When she's delivering, please be there. When she's breastfeeding, encourage her. When she has breastfeeding difficulties, go with her for consultations. You know, encourage her. Do you know that sometimes when women think that they cannot breastfeed, we encourage their men to give them a back massage. Yes. And when they massage them, the women relax, you know. They also want that emotional support of knowing that someone is there. Someone cares. I'm doing it. Do you know, sometimes you do things not for you, but for others. Yes, that emotional support to the women. So not only do they have to support the children and encourage the children, but they also have to support the women right from when the women are pregnant, through delivery, and through the upbringing of the children.
Okay.
Yeah.
And so we are comparing two children, two categories of children.
Okay.
One with a father who has been available. So they've been a part of their story from probably antenatal to birth, then throughout that process up to the time they go to school. And then the other child who has only seen the mother. And when these two grow up, which effect will they have? This one who has seen both parents available, and the other one who has seen only the mother.
You must have, I know you must know that most of the times absent fathers, households with absent fathers, the children are usually unruly. Do you know that? That's one. They are more likely to be involved in, you know, weird businesses, in drug abuse, jail, you know. Most of the time, when the father is absent, the children are unruly. This is everywhere. You can Google it. You will see that this is actually happens when the father is unruly. But we have also seen that when the father is absent, when the father is present, these children are likely to be more confident. They are likely to have, like, you know, I want this, after this I'm going for this, after this I'm going for this. Like the guidance, upbringing, money handling, respect for others, psychosocial development skills. You know, but if the home it is duka, and you see the children are not confident of themselves, they can't speak in public. They, even when they go to school, you know, I've seen people who like study or they have accomplished something, their career, they always thank their parents.
Yeah.
And sometimes it's not even always about the money. My father was there for me. You know, psychologically, children can get scholarships, but were you there? It's not always about the money and providing. No. Yeah.
Well, Pamela, how do we conclude this? I know it has been a very long discussion from where we started way back with breastfeeding. We've come with all those particular topics, but how do we wind up all this discussion?
Okay, so to wind up all the infant and young child feeding discussion is that if I'm to recap on breastfeeding, is that one, ladies should know that they are supposed to attend antenatal care at least 4 times during their pregnancy. They're supposed to take their iron and folic acid pills, at least 90 of them, that is 90 pills, that is 3 months at least. If the pills are not there at the hospital, please, you can buy them at your local drugstore. They are supposed to be dewormed, they are supposed to be immunized, and you are supposed to deliver from the hospital. Then after delivery, you are recommended to initiate breastfeeding within the first hour of birth. You are not supposed to give anything to the child, to the baby, until the breast milk comes. And you're supposed to exclusively breastfeed for the first 6 months. After the first 6 months, you're supposed to introduce complementary foods, which are semi-solid foods, which you give 2 to 3 times a day for infants 6 to 8 months, or 3 to 4 times for children above 8 months. You're supposed to give thick foods, you're supposed to give a variety of foods, give everything, and introduce one food at a time so that you will know if the child doesn't like this food, then you replace it with what the child likes. You're supposed to actively feed the child. Don't force them to eat, encourage them to eat. If they don't like this food, give another food. The males must be involved. Encourage children to eat, to develop healthy eating habits from a young age, and don't reinforce children with junk food. Yeah, if a child refuses to eat, or if they do their homework, they have done their housework, don't give them junk food. It's not a good habit to positively reinforce children with junk food. No, we do not do that. And the men, we have seen that when you involve yourselves in the children's lives, you teach them good eating habits, you go with them grocery shopping, you help them, you help the women, you're likely to have, first of all, a peaceful home. Children, you're likely to bond very well with your children. They are going to trust you, they're going to love you, they are going to remember you for the rest of their lives, that you were there, and you're going to have a stable home. Then also, these children are likely to be more confident, they're likely to be social, they're likely to perform well in school. You know, the peace at home, the peace that the children get at home from male involvement. So I say that I sign out by saying that women, whereas women, we have been stereotyped to be the ones taking care of the children, the males are also supposed to be part of the child upbringing and part of the infant and young child feeding.
Thank you so much, Pamela. It's been a pleasure. And to you, our viewer, thank you so much for watching Church of Uganda Family TV and HealthPot. God bless you. We meet again next time.